Hello, dear colleagues. My name is Mynzhylky Berdikhojayev. Together with my colleagues, Suyumbetov Davlet and Khatbata from Ulaanbaatar, Mongolia, we are transmitting from Almaty city, Kazakhstan country. And this is a case number 3 for today. Patient with with a non-ruptured but symptomatic brain AVM. Patient has seizures, and now you can see the small feeder coming from the choroidal artery on the left side. This artery is going to the AVM, but it looks like it's a collateral. This is distal part of the MCA, and it's connecting with the. It looks like distal branch of the MCA, but I could be a little bit incorrect. It might be venous fistula. Okay, let's see how it's look like on the MCA territory. There are many veins draining. It might be something joint from choroidal. Yes, it looks like high flow AVM, and also the anterior choroidal artery is tortuous, and it's connected to the AVM. Yes, first of all, might be we should go there and occlude it. And if you notice, there is no deep venous drainage. The meaning is if there is no deep venous drainage, it's thrombosed, because the basal ganglia location, usually it should be deep venous drainage. And there are meningeal branches, I think. Мынау, скорее всего, қосылады. Meningeal might be connected. Okay, Davlet made the angiography more selectively. No, it's not connected. Okay, it's nice. Then we should work only with the intracranial circulation. The choroidal, distal MCA. Yes, it might be choroidal aneurysm, and all this part is basal ganglia. It's deep-seated AVM. This part is also going there. The strategy for today is a partial embolization. Because of the lack of the instrument, we will try to do it as safe as possible. Okay, let's check the 3D angiography. Davlet made the 3D. Okay. It's like this. New. What's the new? Reconstruction. Absol already made the new. Okay. This is the area. Okay, just a second. Yeah, let's do soft tissue. Smooth, very. That's a set reconstruction. This is the AVM. This part is It's look like aneurysm, huh? Yes, there is aneurysm on choroidal segment. It might be fenestration, huh? Okay, it's aneurysm. Two main branches of the MCA going, and also choroidal artery, anterior choroidal, is joining the AVM. It's not so comfortable situation. Okay, let's cut this part. Cut. Okay. Yes, nothing is clear, huh? Okay, let's do this one and see the MPR. Okay, let's start. We have 8 French guiding catheter. Так, Eclipse. Так, наншхайский рюкзак, но... Екі набор шприц аштырайыншы пока. Где МС-1 находится? Так, на IQ наш цесл. Отражаешься пока. Баллон. Так, баллон. Баллон на этом. Okay. Okay. We asked Zoya to give a Sonic 1.525, which is without the hybrid inside the box. I don't know why the bulk company started to produce the Sonic without wire. And now the treatment became a little bit expensive because we need to buy the wire separately. Так, восьмерка отжал, да? Так, ДМС аж переслал лейки. Yes, we will collect the DMSO. Because of the size of the AVM, we will do it staged. today it will be the first stage. Yes, it's better to go to choroidal artery and exclude the lower part of the AVM, but it's most risky part of the treatment. That's why. Also there is an aneurysm, the navigation is not so easy. Yeah? Okay, now let's put 2 eye connectors. Экранды аяққа қарай тартасаш и от меня 10 сантиметров. Hello. Now we have on the shelf only 25 Sonic 25. Бізде заявка бойынша септор мини бар ма екен?
Қарау керек, болу керек, бірақ ол әзір. Осы айда жоқ. Енді келмесе. Келесі айда болмаса осы айда жоқ.
Майскет проводник. Yes, we have a lot of problems with the instruments nowadays. Yeah. Yes, we asked for the 8 French Klimber, which is Judkins right, coronary, and then we took a Sonic 1.5 25. 25 is only the length available on the shelf today. Yes. It's a public insurance system, that's why we should work with the instrument the hospital is providing. Okay. Guiding, I hope, inside the internal carotid. Now we are in the MC territory. There is a fistulated part, but I don't want to go there. I prefer to work today with non-fistular part. Okay, let's do angiography. This is fistulated part, I think. Because of the high flow, the distal part is non-visible. Бахара сөзін қосып қоясаш? Ең басынан бастап. Естілмей жатыр. Yes, now it's a normal vessel. Just a second. There is something very distal, huh? It's going to the... Ну, что за ветка? Назад пишешь? А, кішкентай ветка на это. That's a fistulated port, huh? Стоп. Назад. Вперед. Назад. Назад. Вперед. 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 Назад. Вперед. 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 Назад. 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 Вперед. 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 Алды. Стоп. Фишку. Стоп. Назад. Вперед. As this part is fistulated. Эклипсаж. Эклипс и трехходовой краник Ашперса. Yes, we'll place coils distally and then inflate balloon proximally. And that part of the AVM will be occluded by the okay. We'll do pressure cook first. Двойка спиральдар қайсы бар? Двойка спиральдің қайсы бар? Пятерка шпиц. Екіде 6 бере бер. Алдымен 1,5-да 4 бар ма? Иә, бере сал. Microplex durs. Microplex durs. Okay, now I took 3 cc of contrast, 2 cc of saline, connected with 3-way stopcock, and just inflating the balloon and sending the air from the dead space. And contrast is coming. Yes. Yes, now the balloon is fully filled with the 60% saline, and then I put inside the saline the whole construction. It's also possible to inject a little bit fill, but because of the close location of the fistula to the draining vein, I will try to avoid to use the fill. Fill is very effective, but it might create the thrombosis of the draining vein. It's only reason why we don't go there. The branch going down connected to the choroidal artery, that's why we'll leave it to the next session. Yes, and tomorrow we are planning to live stream the case for ISIN's conference in Moscow, and I hope Charbel Monaye is already in Moscow. And I'm planning to join them tomorrow evening. Just after the cases, I have a flight from Almaty to Moscow. And I hope the airport will be open. Huh? It's another problem. Okay. Так, Squid 18 бар ғой, да? Или Menix 34 қоясаш, тез айнала берсін. Minus 34. Yes, we'll start with 34. Minus. And the next case is also the case of brain AVM. Предыдущий не находишь? Oh, it's okay. It's following the sonic, eh? It's a shipping technique. So-called shipping technique. A little bit push the guiding forward. Now we have eclipse in place. Let's control with sonic. Yes. Спира. Coil. Спира. Режер. Асқа. Салған жоқсыз. Так, бір жарымда бірдеме деген тағы ашып бересіз?
Бір жарымда тұрып мынау.
Тағы да бір жарым бере сал. Ага.
Не видит? А, видит.
Yes, the problem is it's a eclipse and we don't see. Yes, the coil is just placed at the orifice of that branch, and now we place the coil more correctly. Yes, now we can detach. Еще раз. Снова детачит. Басқасын бересіз?
Солай беремін.
Смотрите. It's need a little bit saline. It's okay, now it's okay. Давай еще спирин. The second coil is the same, 1.5 by 4. It's helical microplex. Отдели. Если пишет. Okay, let's wait a little bit. And then we'll bring the catheter more proximal. Possible to inflate it. Стоп. Назад. Okay, let's compare. Оп, назад. Вперед. Вперед. Назад. Угу. Вперед. 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 Так, тройка ма спираль норма? Тройка спираль норма? Оптима тройка. Жоқ, одан ұзындығы 8 бер. Okay. Let's place a couple of coils in proximal part. I will try to avoid to occlude the draining fistula, high flow fistula. You can push. Да. Push. There is no need to wait the water. We are waiting water only in standing. Okay. Just a second. Okay. Just let it. I need to. We need to coil just distal to this branch for the next time. It's very high flow. Okay, now it's clear. Hadi. Растет. Отдели. Кончик написано. Ротимет. Okay, let's detach. Now we have markers. Now we have markers proximal and distal. We can wait a little bit more. Okay. Okay, let's start to inject the Minox 34, huh? Yeah, Minox. Just thank you. Just a second. I'll put glue. Little bit more radiation, and now we need to have this image. Thank you. Скотчи наверх сразу дали. Уника. Наркоз глубокий, я надеюсь.
12 декса. Дексаметрон универ наркоз глубокий.
Now I think we need to deflate the balloon and pull it a little bit back. Yes. It will push with flow the liquid embolic. Не родно? Оно родно. Yes, now we're working with the Menex 34, which is the product of India from the company of Meryl. I think this part is going to the vein, yeah? Ровно. Okay. Okay, let's wait a little bit more. Timer vessel. Назад. Вперед. 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 Родно. This part is going to the vein. That's why we'll try to avoid the vein occlusion to the fistula. Fistula is still alive. Okay, let's change for the squid 12. Anam hakikaten özüm kıyasın. Ne diyorsun? The only point I forgot about the markers. I'm so sorry. The markers are there. That's why it's safe. Okay. Till this point is okay. We can detach it. Yes, the proximal marker is outside of the liquid embolic. No, it's AVM. This is the vein. This is the beginning of the vein. Okay. It's becoming the small branch and then it's enlarging, and that point is usually the vein. Вперед. 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 Nice. Вперед, вперед. 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 Yes, the vein is alive. Now we have marker, which is the beginning of the vein. Yes, it's going to the lower part also. It's decreasing the flow. Okay, maybe it's a point to stop, huh? Dalit?
Yes.
Yes, maybe. Yes, the lower part we will do next time. Okay. Ладно, перешел. Yes, we little bit pull the sonic, and now I will inject a little bit more. Sometimes it works better. It might be reflux, huh? Might be reflux. I will pull a little bit more. Okay, that's the Oh, 12. That's okay. Stop. Stop. Okay, let's compare what have been before and now.
Отдельно крылья моря, может, угодно сам. Еще. Вот он.
Let's do it 0. Same size. Yes, those veins are stopped, huh? Those veins are stopped. Now we have only these veins. This one and this one. Okay, it was the beginning. Now we are in this situation. The upper part is occluded. This is working.
Идеальный жар, стреляли дальше.
Обычно 40 вот. And now we see the deep venous drainage. Huh? Yes, now it's nicely visible. And we don't see this part. Let's compare. Yes, this alive, this alive, and those veins are no more visible. Huh? They are visible, but they are working in a normal condition. Okay, if we occlude more, then we may cause the venous stagnation. It's even more risky. Huh? There is a flow. If we will occlude it, what would be after? No. Yes, it's okay, everything is working. And I hope everything is okay. It's a stage embolization, that's why we'll finish at this point, and now Devlet will do control expertity. The next session we can do in a couple of months, huh? Yes, I hope so. Choroidal, I think it would be next session. Почта, choroidal, no? Okay. Okay, let's see the control.
5, 10.
20 может. Ага. Есть, да? Ром? Okay, dear colleagues, this expertise is ready. This is draining veins. This is also veins. This is MC30. Everything is clear. Yes, we can finish the case, and next case, cerebellar AVM. Hope to start in 30 minutes. Thank you for watching. See you in next 30 minutes.